Now, Varun, I am very excited to talk to you about Superhealth because now that you've given us such complex statements, I am wondering how is a 6-month-old company disrupting this space, which is half a century old and has 1,000 crore problem? How are you disrupting the healthcare space, and how is a Superhealth hospital different from a conventional hospital? Walk me through how did you manage to solve this problem?
So, super health, or, what has now become super health, honestly started as a exploration of my own curiosity.
Okay.
Right? When I was sort of inside the healthcare system, before I was at Practo with, trying to solve it from technology. So it's a problem I've been trying to understand for almost 10 years now. And as I kind of went through these questions, that as I learned more about it, I went through the same sort of shock that, you're going through when we're talking about this. And I couldn't reconcile that how can something so important be so badly broken? Why does it work like this? And why has everyone in some ways converged to this? Right? And what we realized were that, there are a few important sort of, I guess, inflection points or something that you could call them, which are that number one was this understanding that we have done a unnecessary implementation of a Western model to India, which does not make sense. It has not made sense in any industry. It does not make sense in hospitals either. We have to do our own model of delivery. The reason for that is because the expectation and the needs of Indian customer is very different. So India is a country with an average median age of, I think, 28 years. So we're a pretty young country, right? I keep telling my team that, when you're 27, 28 years old, right, you don't have healthcare problems because you have mummy and nobody can beat mummy. Okay. Your problem really start a few years later, right? When you have kids and you have this other person you're married to that you take care of, your parents are getting older.
Yeah.
So actually India's healthcare problems are only going to start. As a country, it's only going to come in the next 10 years. We are not prepared for this as a country, right, today, in terms of the shortage of doctors, the beds and everything. So we try to look at what is it that is, causing this problem and arrived at this, model issue. Then we looked at what are the customers doing today, right? And if you go back to what we were talking about earlier, saying that, if 100 people walk into a hospital, 90 do only outpatient care. Remaining 10 get admitted in the hospital, right? Of these 10, 5 are what are called medical admissions.
Okay.
Which means that they need oxygen, they need a bed, they need a nurse. Sometimes they need an ICU, but there is no procedure, right? And then they get better. Someone is having let's say he has COPD, so they have to get nebulized, so they have to stay for some time, or they have dengue, they stay for some time, etc. But no procedure happens. The remaining 5 out of the 10 have surgical needs. Some procedure happens. So if 100 patients come into a hospital, 90 out of the 100 people don't get admitted. They only do outpatient care, which is consultation, diagnostics, and medicines. Okay. The 10 people who get admitted are broken into 5 and 5. 5 have a medical admission, which is you need oxygen, you need a bed, you need nursing care, sometimes you need ICU, but no procedure happens for these 5. The remaining 5 out of the original 100 are the only people on whom some surgical procedure happens. Of these 5, 4 have a discharge time or length of stay less than 2 days.
Okay.
So if you think about it, effectively 99% of the patients today are staying 2 days or less in a hospital.
Correct.
Right? It's the 1% that is staying for longer, which are typically like the transplant cases, etc. Right? Now, if you were to look at search data today as a proxy for intent, you look at Google search data, you look at Practo search data, and I worked at Practo, I know those guys. And you search for these 99% of the problems, what you realize is that the customer today has already moved to proximity. What that means is that they're saying, for example, they'll type best gastro in Bangalore. Then I'll tell them that the person is in Koramangala and the gastro is in Whitefield. The next question is, no, please show near me. Because the customer doesn't want to take the pain of going 1.5 hours or, whatever. They're not searching by doctor names and hospital brands, right? So what that tells you is that fundamentally the category relationship in this segment has already changed to convenience given base quality, rather than finding the world's greatest appendix surgeon.
Correct.
Right? Now, there are procedures that people go for, like transplants or very high-end heart surgeries, for which they will want a named doctor, and that's great. But today, if you look at customer behavior for this ALOS less than 2 procedures or length of stay less than 2 procedures, this is not happening. So when you look at these two things together, you realize that the patient doesn't want to go to the far away to meet a destination center, which is the corporate hospitals today. It costs too much, takes too much time, and they don't want it. So we thought, why don't we just, instead of doing one large 500,000 bed hospital, why don't we just bring it closer to where they are and solve for it at a hyper-local level?
Hyper-local level.
Right?
Okay.
So super health hospitals are hospitals which are hyper-local. We care about only a 3 to 5 kilometer radius from the hospital. So let's say we are starting the first one in Koramangala. So the Koramangala hospital only cares about 3 to 5 kilometers from Koramangala.
Mm-hmm.
Right? We don't want Sarjapur patients to come there or Hebbal patients to come there. For that, we'll open a hospital there.
Okay.
Right? And we create this network of hospitals which is decentralized.
Okay. What's the difference between the bed capacity of a conventional hospital and super health hospitals?
Right. So in terms of number and quantity, it's like, let's say a typical large corporate hospital will be about 3 to 500 beds.
Okay.
We have a fixed bed count of 50 beds.
50 beds?
50 beds, right? And because the length of stay is 2 days or less, right? So our turnover for the patient is higher. So a typical hospital will have a length of stay of say 3 to 4 days. We would be when we are operationally super efficient, we would be at about 1.5 day. What that means is my throughput is the same as a hospital with 4.5 days of length of stay.
Right? Okay, can you explain that with an example?
So length of stay basically means how long you spent in the hospital, how much time did you spend here, and how much time do you how quickly did we get you out. A typical large corporate hospital will have a length of stay between say 3 to 5 days, sometimes a little bit more. So let's say 4 days.
Okay.
We will be at about 1.2 to 1.3 days because of the procedures that we are doing. Right?
Can you walk me through that? Because I'm not able to imagine why would an Apollo keep a patient for 3 to 5 days, and what makes you so super efficient that you're able to discharge the patient within 1.5 days?
So it's not that we are keeping for less days and they're keeping for more days. They do procedures where stay is very long in general. Right? Which are those 1% procedures or 2% procedures, right? Which we don't do, right? So if you want a transplant, Super Health doesn't do a transplant, right? If you need a transplant, we refer you to one of these centers and you can go there and they will do a really good job with the transplant, right? But those things skew your length of stay to be much longer.
Okay.
Which means the throughput of your patient is less, right? So if you're discharging a patient on average in 4 days, right? Then your bed is occupied for 4 days. In that much time, if my length of stay is 1.5 days, I have turned over 3 patients there.
Yeah.
So the patient throughput essentially is 3x between a 1.5 ALOS hospital and a 4.5 ALOS hospital, right? So what that means is my 50-bed hospital effectively acts like a 150-bed hospital, right? In terms of throughput, right? So and the other thing that is very different about us versus them from a room standpoint is that we only do private rooms. There's no sharing in our hospital.
Okay. Why?
Because we believe that sharing is materially worse medically for the customer, because you are at severe infection risk after your surgery. It's become this whole premium VIP situation, which I don't think in healthcare we should have. We should be solving for quality first. So we do only private rooms, and these are nice 200 square foot plus private rooms, nice glazing windows. So there is natural light, which anyway feels more healing. It's quiet, everything. That allows us to serve that community of, let's say, approximately 1 million people who live there. Right? Now, the benefit is that this allows us to rapidly expand. What that means is that today we are taking about approximately 120 to 130 days from signing up the lease of a building and then converting it into a hospital and seeing the first patient.
Hi guys, if you loved watching this clip and if you want to do a deep dive into the podcast, we've mentioned the link in the description. So click that link, watch that podcast and take notes. Thank you for watching and subscribe for more clips.